so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apurv Gupta. And today we are talking about our interview with Chase Glenn, who is the director of LGBTQ plus health services and enterprise resources at the Medical University of South Carolina. And this was a really cool conversation. First of all, I'm glad that we were able to get it done in Pride Month and, be able to add to the content that's out there. And it was a really cool conversation because it's totally different than ones we've had before. I don't think people usually think of things like gender identity and how that plays into healthcare. And it's a real concern, especially people who are living in the community. And I would say, particularly for transgender people. And Chase Glenn is super open about being a transgender man. And so he was talking about the challenges of going to the gynecologist. He hasn't had the surgery, so he still needs gynecological care. And so he talked about some of the barriers that can pop up whenever you're seeking care for your birth gender and then looking like a different gender now. And so it was just a lot of really interesting points that he brought up. Porv, what did you think of? Because you have another interesting perspective on this as a provider and somebody who is now a consultant with other healthcare systems.
Yeah, thank you, Stephanie. I think it was eye-opening, to say the least. I think it's remarkable. Chase is such a fantastic person to talk through, so open and kind and really grounded. I think it was very enlightening for me to understand the perspectives, simple perspectives of the things that he's trying to do. He says are really foundational. We just got to make sure that the gender is input properly into the electronic medical record, because if we don't get that right, then people can't, make the determinations properly. Perhaps the data won't be accurate. We can't refer to their patients properly because their pronouns aren't input into the system properly. So really blocking and tackling basically is what a lot of the work came across as. So it's striking to you that, we may be thinking that we're so advanced in our medical care and our systems and our technology, but when it comes to equity, especially in some of these diverse areas, there's really not enough work that's gone in to laying the groundwork. So I'm glad that there's folks like Chase that are now being hired at these really tremendous positions. He's really got a role for, as he mentioned, the university and the health system, as well as for many aspects of the rural healthcare services. So he's got the opportunity to really help shape equity and access to services for LGBTQ plus for the whole region. So I find that tremendous. The other part that I found really helpful about his message is how much grounded it was in values. He talked a lot about hope and saying, I believe in hope ultimately is what carries us forward. And he believes in respect. And ultimately, when there is a conflict, he tries to bring the conversation back and ground them in the values. Because if there is respect and compassion and there is hope, then there's always a chance that change is possible. So I really liked so many aspects of his message, both from the basic grounding of it as well as to the aspirational values of it.
Absolutely. I loved that hope was the message because that I was going to bring that up as well. That he just, he said it multiple times that hope was what, drives them forward and really gives everybody hope that there will be change just overall, from every aspect of the patient, the provider, all across the board. So it was a really great interview. Stay tuned for the full interview with Chase later this week, and we'll talk to you soon. Bye bye.
Bye bye.